Dear colleagues, a very warm welcome to you to e-learning course Infection Prevention and Control, a primer. I am Dr. Rangareddy, a physician, healthcare enthusiast, and President of Infection Control Academy of India, which is working towards creating a bandwidth of infection preventionists in India and other low resource settings. This course, Infection Prevention and Control, a primer, is a collaborative course which is being offered by University of Hyderabad, Commonwealth of Learning SEMCA, along with Infection Control Academy of India. Today, we are going to have the module which is going to take care of basic concepts of infection prevention, which includes core components and IPC terminology. I am sure you would have enjoyed the module 1 from my colleague who has talked about the infection control and prevention as a science and also its role both in the communities and also in healthcare system. Now today we are going to structure our module in the following way. We are first and foremost going to learn the objectives of the module. Then we are going to familiarize ourselves with basic concepts of infection prevention. We are going to talk about IPC terminology so that you are facilitated to get into the subject with ease. And also we are going to summarize the background and the rationale for infection prevention and control. We are going to outline the approach to core components of infection prevention and control. We are also going to explore how the World Health Organization core components will contribute to the global knowledge pool on what constitutes a model infection prevention control program. At the end, we are also going to give you the instructions so that you can follow up with the learning what you had through this module. So first and foremost, let us look at what is our learning objective for this module. We as the program coordinators, we would like the learners to comprehend the basics of infection prevention and control, chain of infection, important terminology related to infection prevention and control, understand the core concepts and guidelines developed by World Health Organization expert team. After attending to this module, we would expect the learners to first and foremost define basic concepts of infection prevention and control, understand what is chain of infection, understand key IPC terms, identify the key stakeholders in formulating policy both at national and also healthcare facility level. The learner should also be able to identify the key stakeholders in implementing policy at both national and also healthcare facility level. And post completion of this course, the learner should be able to institute the knowledge in a contextually relevant and appropriate way in their own settings. Before we move on further, let me very quickly introduce you two major topics of the day. One is HAI. HAI is healthcare associated infections and IPC is infection prevention and control. Let me tell you that healthcare associated infections are a major public health problem with a very significant impact on morbidity, mortality, and also the quality of life. In fact, hospital acquired infections, apart from morbidity and mortality, it also has got a huge impact of economic burden on the patients and also the systems and societies in general. A large proportion of hospital acquired infections are preventable through effective infection prevention and control measures. And hence, it is paramount for us to understand these parameters, learn how to deal with them and implement them in our day-to-day life. Now, let me go into what are the basic principles of infection prevention and control. What is infection prevention and control? It is nothing but an application of microbiology in the clinical practice. And infections are usually caused by microorganisms, because usually, if we are going to talk about the microorganisms, there are 300 billion, trillion and trillion microorganisms are there, but not all of them are harmful for us, and not all of them would be causing the infection. We would be having some of the bacteria, fungi, viruses and prions which can cause infections in all our body systems, and those of microorganisms which are causing these infections, we call them as pathogens. So, when we talk about infection prevention and control, we are going to effectively deal with those microorganisms which are pathogenic in nature. And at the same time, not all the infections are transmissible. Some are, like for example, if you take influenza or the norovirus, these are very highly contagious and transmissible infections, which will have a very big impact on societies and healthcare organizations. So, understanding how infections occur and how different microorganisms, what we have mentioned earlier, are going to spread is going to be very crucial in preventing these infections. The process of infection can be represented as a chain, which we are going to talk about in our next slide, where how the microorganisms are moving along this chain creating the infection. Before I move on to my next slide, let me tell you that infection prevention and control is the responsibility of each and every stakeholder within the healthcare system, be it the doctor, be it the nurse, be it the technician, or be it actually the administrative staff. Whoever are working within the healthcare environment, they are all responsible to ensure the patient safety through infection prevention and control implementation of these guidelines and process. So, and hence they play a very key and vital role in ensuring the patient safety. So, let us very quickly look at what are the factors which are involved with hospital acquired infections. We talked about them. First and foremost, these are the microorganisms. We call them pathogens, which are causing the infections, and the host, usually it is the patient. The carriers, it is usually the healthcare workers who move from one patient to other patient while providing the clinical services, and the environment within the hospital, within the healthcare system, and the treatment itself also can be a factor involving with hospital acquired infections, because a misuse or indiscriminate use of some of the antibacterials, antibiotics, etc., also can cause antimicrobial resistance, which can further aggravate the problem of hospital acquired infections. Now, look at the chain of infection. So, if you look at, there are 6 major components of this chain, or we call them as 6 links within the chain. The first and foremost, of course, these are the infectious agents. We have talked about them earlier. They could be fungi, they could be bacteria, they could be virus, and they usually be present in certain reservoirs. Within these reservoirs, they grow, they multiply, and then through the portals of exit, they tend to actually move out, like the blood, the secretions, excretions, skin, etc. From there, they would be getting through the modes of transmission, right? They can be physical, they can be droplets, they can be airborne. So through these modes of transmission, they would be entering into the portals of entry. And what are they? The portals of entry usually are the mucous membranes, the respiratory system, the digestive system, broken skin, etc., etc. And then if we had to have the infection going within this chain, we need to have a susceptible host. And who is this host? Typically, these are the people who have got a low immunity. This could be the people who are aged, who have got again low immunity. This could be the patients with chronic diseases like diabetes, where they are susceptible for catching the infections. That is how this whole chain would be closing from infectious agents to the susceptible host. And again, the chain would move on further into the next level from the susceptible host who becomes infected. Again, he would be passing it on to other people. That is how it goes on. So now, before we move on to the major topic of the day, which is the core components, right? Let us look at few of the key terms which we would be using again and again during today's presentation or today's module and further modules which are going to be taken by my colleagues. Few of them I would like actually to bring to your notice, and also I would request actually to memorize them so that it is easier for you to follow what the lecturers in the further courses are going to talk about and comprehend them so that it is easier for you to implement them. One of such key terms is ABHR. It is alcohol based hand rub. As we all know that alcohol is a very potent antiseptic agent. Either it is ethanol or isopropyl alcohol. When you are going to apply to the hands or the skin, it is going to inactivate microorganisms, or it can temporarily suppress their growth, making the hands safe to provide the care within the healthcare system. The second such term would be AMR. It is antimicrobial resistance. Bundle, what is it? It is an implementation tool to improve the care process and patient outcomes in a very structured manner. HAI, we already have talked about it in our earlier slides, and HCW, it is healthcare worker. That is, any individual who is involved with the patient care is called as healthcare worker. ICU, it is intensive care unit. IHR, that is international health regulations. IPC, I am sure by now you very well grasped it already. And then LMIC, that is low and middle income countries. Multimodal strategy. I would like actually to request your special attention to this particular term, because this is going to play a very vital role in understanding the core concepts. A multimodal strategy comprises with several elements or components implemented in an integrated way with the aim of improving an outcome and changing the behavior. These are the key words. Please remember it forever. This is the integrated way of dealing in order to improve the outcomes and changing the behavior. SDG, it is Sustainable Development Goals, which are prescribed by United Nations. SSI, surgical site infections. WASH, again a very, very key term for you to remember, that is water, sanitation and hygiene. WHO, of course, it is World Health Organization.